Hello everyone, and welcome to our April edition of our newsletter in which we provide a brief update of the health awareness events during this coming month. My name is Sabine, I'm the Community Engagement Officer here at TDHS, and I'm joined by Amanda. Hi Amanda.
Hi Sabine.
She's our Health Promotion Officer. Thank you for joining me, Amanda. We certainly are doing a fantastic job here in Australia, aren't we? I spoke to my mum, my family's in Holland, for those that don't know, and they are so envious about how Australia's doing. They're in lockdown again in Europe until June, some countries, and we're just doing absolutely amazing. But we do still have to continue to be vigilant, don't we, Amanda?
We sure do, Sabine, and we also have a lot to be grateful for. We're all doing a great job, but as restrictions ease, there is more opportunity to travel and catch up with our loved ones, including our elderly. So social distancing, hand hygiene has become the norm, but the important message still remains that every test helps us to keep on top of the virus. So even if you have the mildest symptoms and have been tested before, please get tested, stay at home while you're waiting for those results. Testing can be done at the health service by calling 555 86 000 or the Timburn Clinic by calling 555 86 088. And it's worth mentioning that our social support group and our exercise classes have all started to resume, different but the same. So it's really good to see everyone back with following COVID safe rules, but they are back.
Yeah, which has been great to see. I know the social support group members were
really
very keen and excited to be back. So it is fantastic how we're going. And the 18th of March was a very exciting day at our hospital and a major step forward in the protection against COVID.
It was, and it was great to be involved in that. So 3 of our current aged care residents and 25 priority 1A staff members received their Pfizer vaccinations, the first of 2 doses, to help us protect them against COVID-19. The Victorian Government is still on schedule with the rollout of different stages, and we will continue to provide updates to our community as they come to hand, so stay tuned.
Yep. And April is Go Blue for autism, and community member Charlene Payne explains in our Autumn Quarterly, which is out, the importance of trusting your gut when it comes to autism spectrum disorders. And autism affects more people than we think, doesn't it, Amanda?
Oh, definitely. There's many different levels of autism. It's complex, lifelong developmental disability that affects a person's ability to communicate, interact with others and cope in everyday situations. But as Charlene bravely explains in the article, we know so much more than we did 15 years ago, and raising awareness and talking about it just increases greater understanding and acceptance.
Yeah, it's very important to talk about it and
get
to know other people that deal with that as well and their experience, isn't it? World Immunisation Week is from the 24th to the 30th of April, and that marks that our flu season is here. Amanda, as our immunisation nurse, can you briefly explain why getting a flu shot is just as important as ever?
Whilst flu vaccination doesn't prevent against COVID-19, flu vaccination is critical in protecting general health of Australians from influenza, which can take between 100 to 1,000 lives per year depending on the severity. Receiving a vaccination from April provides optimal protection in peak period of influenza circulation, usually from June to September in most parts of Australia. Flu vaccinations have been ordered and will keep the community informed about when they will be available through the healthcare service and the Timburn Clinic.
Now in this Autumn Quarterly, we also reintroduce our Consumer Participation Committee members. We wanted to put a face to the names so community members can pass on their feedback onto them if they don't have the opportunity to approach the healthcare service themselves. Community feedback is very important for our healthcare service, isn't it, Amanda?
Yes, it plays a pivotal part of our mission statement, which is working together for a healthy community. The members of the CPC meet bi-monthly and are guided by an annual work plan, which includes review of quality of care calendar, volunteer engagement, as well as health literacy regarding our brochures and service requirements and needs in our community. The next meeting is in April, and we encourage community members that if they have any feedback, both positive or negative, to pass it on to a CPC member to discuss at the next meeting. Really important to get that feedback.
Yeah, we'd love to hear from you as a community. Thank you, Amanda, for helping us to highlight some April health awareness events, and you can read some wonderful community member stories in our quarterly, and also some more information about what's on, and the quarterly can be found on our website or in Timboon, Simpson and Port Campbell. Before we go, this Sunday, the 4th of April, Daylight Saving ends, which is actually a very handy reminder, as per the Fire Protection Association Australia, to actually change the batteries in your smoke alarms, because smoke alarms save lives, but not if the battery is flat. So it is a good reminder, and you can find more information on the website with regards to smoke alarms and the battery replacement. Thank you for joining us, and please check our social media for wonderful stories that come out of our community about resilience and how inspiring people are. One health awareness we can all be part of is to be kind to yourself and each other. As I keep on saying, we've been doing such a fabulous job in our community, and together we do get through this. Please stay apart, stay safe and stay kind as we work together for a healthy community. Thank you. Thank you, Amanda.
Thank you.